Good morning, everyone. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. My topic today about fetal circulation. So, what we wanted to discuss today, the normal fetal circulation, the changes that occur at placental stage, the adaptation to extrauterine life, the structural changes after birth. So let us start with the fetal circulation, and please look to this picture. This is the placenta, this is the umbilical cord containing one umbilical vein and the two umbilical arteries. The one umbilical vein carry the oxygenated blood from the placental side to the fetus, while the umbilical arteries carry the deoxygenated blood from fetus to the placenta to the maternal side. So the change of oxygen at the placental side to the umbilical vein, the oxygen carrying vessel is the umbilical vein 1, while the deoxygenated blood carried on the two umbilical arteries. Okay, this one. Okay, so we wanna to know this fetal circulation at different levels. At the level of the umbilical vein, which you will look red in color here, this is the umbilical one, and when you see it red means highly oxygenated blood. Okay, this is the umbilical vein. So we will know what are the changes that will happen in the umbilical vein in the fetus. Then at the level of the liver, what will happen? Then at the level of the heart and the great vessels and the lungs, then the ascending aorta and the descending aorta, then at the level of the umbilical arteries here, and the changes at the placental side. These are the different sides we wanted to touch today. Okay, what about the umbilical vein? When the umbilical vein enters the fetal umbilicus, it branches into two veins, ductus venosus and the portal sinus. This is the ductus venosus, as you see here in the picture, and this is the portal sinus. Then the ductus venosus will join the inferior vena cava here, and this ductus venosus carry oxygenated blood with the inferior vena cava to the right atrium. Okay, okay. While the other branch is called the portal sinus. Both of them, the ductus venosus and portal sinus, will give branches to the liver to give blood supply with oxygenated blood and the nutrient to the liver. Okay, what about what will happen at the liver? The liver tissue still needs oxygenated blood supply. Okay, so this is provided by the branches from the portal sinus and branches from the ductus venosus. Okay, okay. What about the deoxygenated blood? The liver will give the deoxygenated blood through the hepatic veins to the inferior vena cava. So, inferior vena cava will carry oxygenated blood coming from the ductus venosus, which join the inferior vena cava, and carry at the same moment some little amount of deoxygenated blood coming from the liver through the hepatic veins, which join the inferior vena cava also. Okay, once the blood has circulated through the liver, the resulting deoxygenated blood from the liver needs to be drained. Okay, as we said, deoxygenated blood leaves the liver through the hepatic vein, which drain into the inferior vena cava, as seen here in the picture. Therefore, inferior vena cava In the fetus carry oxygenated blood from ductus venosus mixed with a small amount of deoxygenated blood from the hepatic vein. What about at the level of the fetal heart? After being carried through the inferior vena cava, the next step for blood is the right atrium of the fetal heart. Okay. In the fetus, the developing lungs are bathed in amniotic fluid and have no access to oxygen. Thus, the placenta supplies all oxygenated blood, and there is no reason for blood to enter the lung oxygenation. Okay? Okay. So, the fetal heart, therefore, serves the sole purpose of pumping blood to all organs, to all systemic circulation, and they bypass the lung because I don't need the blood to go to the lung because there is no function yet to carry oxygen from the lung because the placenta carry this job. So the blood when go to the through the inferior vena cava to the right atrium will bypass the lung through two ways. One of them is the foramen ovale between the two atria. So the blood will pass through from the right atrium to the left atrium through the foramen ovale. This is the first bypass for the lung. The second one through the pulmonary trunk. Pulmonary amount of blood which pass to the right ventricle and go through the pulmonary trunk or pulmonary artery will be shunted to the ascending aorta, what is called ductus arteriosus. So the amount of blood from the pulmonary trunk will again join the ascending aorta through ductus arteriosus here. That's the ways to bypass the lung through the foramen ovale from the right atrium to the left atrium and from the pulmonary artery or trunk to ascending aorta through ductus arteriosus. Okay, so this is how to pass the lung. Blood travel from the left atrium to the left ventricle to the ascending aorta and then pump it into systemic circulation through the descending aorta here. Okay, the deoxygenated blood entering the right atrium via the superior vena cava. This is the superior vena cava. As you see, it looks blue because it is deoxygenated blood. Okay, this blood will miss the foramen ovale and will descend through the valve here to pass to the right ventricle, from right atrium to the right ventricle. The blood then pumped from the right ventricle to the pulmonary trunk here. However, the lungs are filled with amniotic fluid, creating pressure which is too high for blood to enter the pulmonary arteries at this point. So there is resistance because the amniotic fluid filling the lung. So the blood pressure facing a resistance. Okay, so that's why there is here the ductus arteriosus, which connect the pulmonary artery to the aorta. So the blood through the pulmonary artery will be shifted to the ascending aorta in spite of being must go to the lungs because the lung is not functioning as oxygen source right now in the fetal life and filled with amniotic fluid. Okay. What about the ductus arteriosus? This is the ductus arteriosus as you see it in the picture is maintained in utero by prostaglandin which have dilatory effect on the vessel. And that's why we advise any pregnant lady not to take non-steroidal anti-inflammatory drugs in the last 2 months. Why? Because antiprostaglandin, non-steroidal anti-inflammatory, may cause premature closure of ductus arteriosus during fetal life, and it must be kept patent during fetal life for keeping the blood to pass from pulmonary to ascending aorta. Blood which had been shunted around the lung through either mechanisms, either foramen valve or ductus arteriosus, is then pumped to systemic circulation, as we said, through ascending and descending aorta to all body organs. What about the umbilical arteries? We have two umbilical arteries. We said umbilical cord contains two umbilical arteries, which lacks blue here, which coming from the internal iliac vessels. These umbilical arteries carry less oxygenated or deoxygenated blood to the placenta to become again reoxygenated and pass through the umbilical vein and repeat the circulation. So we have oxygenated blood and non-oxygenated blood. To summarize, blood comes from the placenta, reaches the right atrium as follows: umbilical vein first, then ductus venosus, yes, as in the picture here, look here, then inferior vena cava, then right atrium. Most of the blood of the right atrium pass through the foramen ovale, as this arrow directs, through the foramen ovale. To the left atrium, left ventricle, then to the aorta. Okay? Some of the blood of right atrium pass to the right ventricle, to the pulmonary artery. The blood coming from superior vena cava, the right atrium, pass to right ventricle, and from the right ventricle to the pulmonary artery. But most of this blood is directed to the aorta through ductus arteriosus, as we said before, through this shunt. What about the deoxygenated blood? To summarize, blood comes from the upper part of the body, brain, head, neck, and the upper limbs by superior vena cava. Yes. Two umbilical arteries, this one and this one, branches of the internal iliac artery, carry the oxygenated blood from the fetus to the placenta. Yes. What about the fetal blood at placental stage? Please look to this picture. This is the umbilical vein, red in color, one umbilical vein and the two umbilical arteries. And we said umbilical vein carry oxygenated blood and the umbilical arteries carry deoxygenated blood. The change at the placental level for oxygen and the nutrient pass from mother to the fetus in this direction, and the passage of carbon dioxide, urea, and the other hormones from fetus to the mother in this direction. There is no mix between the blood of the mother and that of the fetus. The chorionic villi, which contain the vessel of the umbilical cord, don't mix with the fetal pool of blood around them. And there is what is called the placental barrier. And through this placental barrier, oxygen and the nutrient diffuse from mother to fetus, and the CO2 pass from fetus to the mother. Okay, so at the 4th month of gestation, please look to this picture. The placental membranes become thinner, bringing the fetal side closer to the placental side. This allows for an increased rate of exchange with placenta to accommodate the increased demand in fetal circulation as the fetus grows larger. The placental membrane is not a true barrier. It allows for efficient separation of fetal from maternal blood while still allowing movements of material to facilitate metabolic and respiratory needs of the fetus. At the time of birth, two main triggers induce the structural changes. One of them is cessation of placental blood flow. After delivery and cessation of pulsation, there is no more blood in the umbilical vein to pass in this circulation, and also no more blood in the umbilical arteries in this circulation. And the another reason which will make the structural changes is the initiation of respiration. The lungs will carry its job as a source of respiration and the oxygen delivery to the fetus in spite of placenta. So this is the two main changes that will happen at birth and will do structural changes in the fetus. Okay, how the baby adapt the extrauterine life. At birth, baby makes breath, which helps to create negative thrust pressure. Okay, and this negative thrust pressure will make the blood to be pushed from the pulmonary artery to the lung. The majority of blood will now enter the pulmonary arteries and circulate through the lung vasculature. It is then collected and returned to the left atrium via the pulmonary veins. So the pulmonary artery will carry its job very well to pass the blood to the lungs, okay, and the circulation inside the lung will occur, and then the pulmonary veins will regain the blood inside the left atrium to the left ventricle, and then the oxygenated blood will be pumped to systemic circulation. The placental circulation ceases soon after birth, and so less blood returns to the right side. No more circulation through ductus venosus to the inferior vena cava, so the blood to the right side decreases. In this way, the pressure of the left side of the heart is greater because of two reasons. No more ductus venosus blood to the inferior vena cava to the right atrium, and at the same moment there is pulmonary circulation sending blood to the lungs, vascular system, then through the pulmonary vein again to the left side of the heart. So the left atrium pressure becomes higher than the right atrium, which will help closure of the foramen ovale by the septum primum is pushed against the septum secundum, and this close the foramen ovale. So no more shunt between right atrium and left atrium. Okay, with establishment of pulmonary respiration, the oxygen concentration in the bloodstream rises, and bradykinin released from lungs then act on the ductus arteriosus. You remember the ductus arteriosus which connect the pulmonary artery to the ascending aorta? Now bradykinin released from lung and cause vasoconstriction and cause contraction of the muscular vessel wall, leads to closure of the ductus arteriosus. So no more shunt between the pulmonary artery and ascending aorta. The cessation of the placental circulation results in collapse of the umbilical vein, the ductus venosus, and the umbilical arteries. The umbilical vein will be ligamentum teres, okay, and the ductus venosus will become the ligamentum venosus, and the umbilical arteries will be medial umbilical ligaments in its distal part. So all these changes occur at the level of the placenta, cessation of the placental circulation, and at the same moment the pulmonary circulation work on, and the closure of the ductus arteriosus to make the left atrium pressure higher than the right atrium and the closure of the foramen valve. Okay, so lastly, the structural changes after birth. Look to this table, please. Foramen ovale will be what's called fossa ovalis, the resulting layer of tissue which completely closes the foramen ovale, and it is visible in adulthood as a depression within the septum of the right atrium. What about umbilical vein? Ligamentum teres will be called ligamentum teres, which is a fibrous connection between the anterior surface of the liver and the anterior abdominal wall, and this considered the lower portion of the falciform ligament. What about the ductus venosus? Will be changed to be ligamentum venosus after delivery, a fibrous remnant coursing from the ligamentum teres to the inferior vena cava. What about umbilical arteries? Its distal portion will form the medial umbilical ligaments found on the anterior abdominal wall and connected to the umbilicus. The proximal portion remains open and will form the superior vesical arteries. What about the ductus arteriosus? Will form the ligamentum arteriosus. In response to initial respiration, bradykinin, as we said before, get released from the lung, leads to contraction of the vascular wall of the ductus arteriosus, making it ligamentum arteriosum. This is a structural change after birth, and this is to summarize our lecture today. Please look to this picture. This is during fetal life circulation, and this is after birth. Okay, we should notice the difference. This is the placenta with umbilical cord, and the umbilical cord contain single umbilical vein carry oxygenated blood from mother to the fetus, and the two umbilical arteries carry deoxygenated blood from fetus to mother. Then we said that the circulation goes through the umbilical vein carrying oxygenated blood, which at the site of the liver will give two branches. Ductus venosus will join the inferior vena cava and the portal branch, portal sinus. Okay, and then the oxygenated blood will go through the inferior vena cava to the right atrium, and from right atrium through foramen ovale to the left atrium, and from left atrium to the left ventricle to the ascending aorta to whole body system. Okay? Okay. Also, we said that superior vena cava will bring the blood to the right atrium, to the right ventricle, and through pulmonary trunk, but the lung is still filled with amniotic fluid and there is resistance, so the blood will not go to the lungs because the lung is not carrying its job as a respiratory and the oxygen source, because the placenta carried the job. So there is shunt here called ductus arteriosus connecting the pulmonary to ascending aorta. Then the blood will be shifted to the descending aorta to the whole body system. Then we said that the two umbilical arteries arise from the internal iliac arteries. This is the umbilical arteries carrying the less oxygenated or deoxygenated blood from fetal side to the maternal side through the placenta to regain lost gaining to regain oxygen again, which will go through the umbilical vein and repeat the circulation and give CO2 to the mother and take oxygen to be passing through the umbilical vein. So, what will happen in each structure? Again, foramen ovale between the pulse atria will called fossa ovalis. Back to this picture, this is the name and during fetal life, and this is after delivery. Foramen ovale will be fossa ovalis. What about the ductus arteriosus? Will be ligamentum arteriosum here. What about the ductus venosus? Here, the ductus venosus will be ligamentum venosum. This one, but this one. Okay. What about the umbilical vein? Umbilical vein will be ligamentum venosum, which is a fibrous band extending from the liver to the anterior abdominal wall. What about the umbilical arteries? Sorry, umbilical veins will be ligamentum teres, which extend from the liver to the umbilicus to the anterior abdominal wall. What about the ductus venosus? Will be ligamentum venosum. What about the umbilical arteries? Umbilical arteries will be the medial umbilical ligaments, as you see here in its distal portion, while the proximal portion will be superior vesical artery, will be become still patent and form the superior vesical artery. This is the end of my lecture. Thank you. See you later on.